Hi, Mr. Himanshu. Welcome to this webinar. I hope people are joining in. We'll start in another 5 minutes. Hi, Mr. Rajat. We are also going live on our Facebook page. We are live on our Facebook page. So I think people who are on our group, they can join through our company's page, Mother Your Child on Facebook. Hello, Mr. HP. So we'll start in another 2 to 5 minutes.
Hello.
Hi, Mr. Nilesh. So hello everybody. Let's start today's event. Hello. Yeah. So first of all, my name is Piyush Sanduja. I'll be your host today. I'm the co-founder of Mother Your Child, and I'm a graduate of IIT Kharagpur and Indian School of Business with 12 years of relevant experience in healthcare. So first of all, Mother Your Child is a pediatric healthcare company that wants to provide holistic health and 24 child care services at affordable subscription prices. In 5 years, our aim is to reach out to 5 crore children of India. And so this is about the company. So as you all know, we have gathered today for today's event. And the topic of the today's event is picky eating in our children and what is the science behind it and what are the solutions. And for this event with me today, we have two doctors. First of all, Dr. Monica Singh, who's a pediatrician, and she has got 10 years of experience, and she's an MBBS, DNP, and MRCPCH. Welcome, Dr. Monica.
Thank you, Piyush.
And second, we have Dr. Garima Yadav with us, and she has got more than 6 years of experience, and she's a Bachelor of Ayurveda Medical Sciences and a postgraduate in Child Nutrition. Welcome, Dr. Garima.
Thank you so much, Piyush. Thank you.
Yes. So as you all know, the way we proceed is first I'll be asking some of the questions from our doctors, and in first 15 to 20 minutes they'll answer those questions. And in the meantime, if you have any questions regarding your child and if you're facing any problem from your side, then you can also write down your questions in the chat box, or you can ask those questions after 20 minutes directly from our doctors. So without further ado, let's start today's session. The first question that we have got from our parents is it's a very general question. What is picky eating? And I'm asking this question to Dr. Garima.
Yeah. Hello. So picky eating, generally, it is classified under feeding difficulties. And when you want to characterize it, it is characterized by unwillingness to try familiar food or to try new food items. Okay. Slowly, over here, the food preferences become strong And because of that, the children, they consume inadequate variety of food. That is what you can call it as picky eating.
Okay. And Dr. Monica, would you like to add something into it?
So in picky eating, the behavior has to last for more than 1 month to call it as picky eating. If it is an acute problem lasting only 5 to 10 days, we do not call it as picky eating. To add to it, Dr. Garima's definition, we need the problem to last for more than 1 month.
Okay. So what I've understood is it is a common behavior in the children of India. And there are two major important things: is either children reject the food, a new food, or they reject the familiar food.
Right.
And the problem has to last for more than 1 month. Okay.
Right.
So Dr. Garima, can you tell us what is the prominent age group in which this particular problem happens?
The prominent age group is to say starting from 2 years and it goes till 4 years, which we define it as preschool kids. But sometimes, yes, it can also go till 5 years. So it's 2 to 4 years.
2 to 4 years, you say?
Yeah.
And can you shed light, more light on the statistics? What happens in India as such? What is the statistics?
In India, if you say half of the children, 40 to 46% of the children of this age group, they are suffering from picky eating.
Half,
yes, 40 to 46%.
You want to say that every second child in India is suffering from picky eating?
Correct.
And Dr. Monica, what is your say on it?
Yeah, the prevalence, when we see OPDs, it's around 50 to 52%. One in two children, they come to us with the same problem. The parents come to us with the same problem, that they do not eat well.
Okay. And is it because, are there any guidelines, and who has researched on it? Is it from Indian Academy of Pediatrics? Are the numbers provided?
Indian Academy of Pediatrics has also done a study, but the sample size was very small.
Okay.
And it showed the prevalence to be around 50 to 52%.
52%.
It's around the same number as Dr. Garima is saying, between the same age. Yeah.
So it is not a small issue. It is a big issue because more than 50% of the children of India are suffering from picky eating. And when you're saying 50%, this is specific to the age group of 2 to 4 years. Am I right?
Right.
Okay. And what is the science behind picky eating? Dr. Garima.
The science behind picky eating, when you want to say, it's your DNA, which is genes, and the upbringing, which is the environment.
Okay.
So combination of genetics and environment is the basic science behind picky eating. But over here, when I say genetics and environment, for each and every child, both the things will not be there. For some, it might be genes. For some, it might be environment.
Okay.
Yeah.
So you want to say that it's not just the environment, which generally our parents feel it's just the environment. So it's not just the environment, but also the genes. So
Yes.
There is something that gets carried through the genes and it passes on to our upcoming generations, next generations. It's what you're saying, right?
Yes.
Okay.
The olfactory senses, the receptors, the smell part of your body. What happens when a mother conceives, a lady is pregnant, so she have problem with some of the smells, textures, or taste. So that is carried in a baby. As an example, you can take, we all have seen and we have heard in our society that the lady is pregnant. She doesn't like when we go to petrol pump, or when the paint is going in the house, she is with the mouth tied. No, I don't want this smell. So what happens at that time, it doesn't look so big, like, okay, it will be okay within 9 months. After this, nothing would be there. But sometimes this time it is inherited in the mother, and from there it is carried to the child, and as a result you see the child as a picky eater.
Okay.
Yeah.
So this was the example that you've given is that of a pregnant woman. So similar things can be carried through genes from other parents also.
Yes, definitely. Normally also from the parents, if parents are having this olfactory receptor problems, they are having problems to any of the odor, smell, or taste, it can be carried to a child.
Okay.
Their child, I would like to say.
And what are the major factors in the environmental side that you just talked about?
The environmental side, majorly, it takes your own meal time, the family time, which is your meal time. After that, it is the fast food or the processed food.
Okay.
What the child is taking. Media exposure is also there, definitely.
Okay.
And all these things together, they are the environmental factors responsible.
Dr. Monica, do you have something to add here?
Yeah, adding to what Dr. Garima said, there is also physiological decrease in appetite between the age of 1 to 5 years.
Okay.
And mostly we forget that. And we overtreat picky eating as a very serious disorder. It is a serious disorder, but it does not have to be always treated.
Okay. 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 So probably we'll discuss more about it when we talk about the strategies or solutions.
Yeah.
And continuing this discussion forward, we talked about the environmental factors. So probably it's the right time to dig deeper into these environmental factors and talk about what are the major causes behind picky eating. Dr. Garima.
Yeah. So major causes, first of all, the early feeding difficulty. When the child is not ready to accept the purees, the semi-solid food. After that, late introduction of lumpy food in the weaning time. Weaning time is the time where you have to introduce the purees, the semi-solid food, and then pressure to eat, forceful eating, you can say.
Okay.
When the mother is so much worried and the feeding becomes a forceful process, you have to take it. That's also a major cause. And after that, the provision where you are supplying fresh food every time. I don't want to eat it. A mother gets up from the table. Okay, whatever you want to eat, I'll prepare, and that is served for the child.
Okay. Okay. Okay.
So these are the basic causes which we are seeing daily in these children. As I just want to ask Dr. Monica also, she must be finding these issues every time in the clinic, that yes, the mothers are coming with the same thing. It might be like
they do not, do not try much. They try feeding the child the same food once or twice, and then they say, no, he's a picky eater, he's not eating it. They do not know that it has to be, tried at least 8 to 10 times before calling the child a picky eater.
Okay. Okay. So you've talked about some 4 or 5 issues.
Yes.
And the parents we talked to, they gave us some questions and they have some questions. So the first thing that you talked about was feeding difficulty. The first cause of picky eating is feeding difficulty. So when you're saying feeding difficulty, do you mean that there is some chewing problem, or the chewing and swallowing process has not developed in the child? Is it what you're saying?
Yes, that you can say when you compare them with the other children's, the oral motor part, your jaw part, the muscles are there which are called as oral motor muscles. Over there, this part is not developed properly. So this child is facing the problem in chewing. Chewing means when they started with the gums, the muscles are not supporting the child. He want to do it, but when the pain is there, he can't do it, then he doesn't want to do.
Okay. Okay.
So ingesting the food or swallowing the food when the child is facing difficulty, that is the early feeding difficulty.
And so ideally, the child is breastfed for some time. After that,
yes,
the weaning process starts from semi-solid to the solid foods, right?
Correct.
And once the solid food starts, the weaning process is over, and the whole food has got, it's a solid food that the child is taking. Don't you think this motor should get developed, or muscle should get developed by the age of 2? Because I think the weaning process starts early on. And probably that is what your second point is. There are some weaning difficulties that parents face.
Yes, it actually happens. No, we don't notice the correct weaning time. Weaning time, it starts from 4 to 6 months and it goes till 9 months. Okay. Over here, if you have started feeding the child with the purees, semi-solid food, and then gradually towards the lumpy food, then you will not face all these difficulties, I would like to say. Why? Because slowly, you are starting with the puree. Then I'm not saying directly to the semi-solid food. I'm saying first a puree, yes, then go to a semi-solid, or you can say mashed food item, yes, lumpy food item, and then go to the semi-solid food. When you go gradually towards in this path, then definitely I believe that this problem will not be there.
Okay.
Yeah.
So you want to say that if the weaning is delayed, Ideally,
Correct.
as you said, it should start from 6 months onward, right? And if
Yes,
it has
yes,
not started on time, that can cause to child become a picky eater, right?
yes, correct.
Okay, okay, okay. So next part was because majorly parents come and they are very irritated that a child takes a lot of time to finish the food or doesn't eat certain kind of food. And what we feel is that the parents are pressurizing their children, and that is what the third point that you've raised is, there is pressure to eat. What?
Yeah. So this pressure is like a mind pressure on parents also, and slowly it get towards the child. What happens, sometimes the mothers, they are very much worried that my child is underweight, he is not developing properly. So what they do, they serve a meal and they want, as we are doing, the child should also finish that particular meal. I would like to say the full complete meal at that time.
Yes.
Over here we go wrong. He'll eat it, but the thing is, you have to serve the meal in small portions. He can't complete the full meal at a time.
Okay.
And when he is not completing the full meal at that particular time, you start forcing the child, like, why you are not eating it, please complete it. And over here, this irritation part comes. Now the child have irritating when the meal is served on the table. Now she will start with me, or he'll start with me, that you have to eat it. And over here, no, this should not happen. The child should love food.
Yes.
Okay, he should be happy when the food is served on the table. But what happens, because the full meal is there, you are not dividing into small portions. So the child is forced to complete the full meal to eat the whole plate. That is the thing which comes over here, where the parents force the child and the forceful eating is seen.
Right. No, I was reading somewhere that the child generally needs up to from 1,000 to 1,300 of calories. And either they can, as you said, so there is no need to force feed the child in a single meal. If the lunch, generally in India, lunch is a heavy meal. Similarly, dinner is a heavy meal. So they don't need to force the child and have the whole heavy meal in a single go. They can divide it into 2-3 parts. And probably that is where your fourth point comes in, wherein you talked about either the parents are worried. That is where the pressure is coming from. Like either the parents are worried or they are being protective.
Protective, we say, like, okay, they are tired of doing this. They don't know that we have to distribute into small portions. They are thinking that whatever we are serving, the child is not eating. Okay, let's try. If the child is not eating, whatever you want to eat, I'll serve that. Okay, so he just want to eat the processed fatty foods,
yes,
which taste sugary and salty, the two taste which just now the child is introduced to. So just over here, the processed food also jumps in.
Yes.
And when the child takes that processed food or the junk food, we all know very well that he will feel full. Empty calories part. I just want to introduce this part over here. That means the nutrition will be zero over here, but he'll feel full.
Okay.
So when you will serve the nutritional part, the child will not look onto that.
Okay. And
he is already full.
Yes. And while we were discussing the environmental problems or causes of picky eating, you mentioned media exposure. And last week we had a webinar on screen time, wherein Dr. Monica talked about children getting exposed to different kinds of, I would say, bad fooding advertisements. How does that affect picky eating, or how does that result in picky eating? First Dr. Monica and then Dr. Garima.
Children, they do what they see.
Yes.
If that's the only thing, if the unhealthy food products are the only thing that they're seeing on screen, then they'll tend to eat those things only, or they'll tend to coax their parents, to give them those things. And the parents, they agree to that, then obviously the child will have it and then he'll eat it.
Yes. And what about you, Dr. Garima?
For me, it's like their cartoon characters are jumping into their heads because of the television or the videos which is going on, and the cartoon is on the packet. I don't want to take the name, but he is here, or some gift items are coming out when he just opens the packet. So that is the best food. Now, what we have to do over here, make the stories with the banana and mango also. That's the part what we have to start with. Why? Because they have made the story. The media people, they have made their stories how to attract the child towards the food. But now it's our turn to make the stories that how you have to attract your child towards this nutritional food item. That's all what I want to add with Dr. Monica here.
Yes. So how many parents, parents who have joined or who are watching us on live on Facebook, how many parents face similar kind of difficulty wherein child is exposed to media or probably coaxes the parents to watch the TV while eating food? You can please comment yes or no in the chat box. So in the meantime, because this actually reminded me of a story of one of the parents that we had a word with, and the parents said that he and his wife, they're working 12 to 13 hours per day, and their child, she's just 2 years of age, and she takes 2 to 3 hours to finish the lunch, and it takes 3 people and a TV to negotiate with her to finish the lunch. So now here. Last week we discussed that if the child is of 2 years of age, then the media exposure or screen exposure has to be of up to 20 minutes. But here the child is finishing the meal in 2 to 3 hours while totally hooked to the screen. What do you have to say about some similar situation, Dr. Garima? Is it right to negotiate with the child like this?
See, negotiation with the child, like it happens. It's just a general thing. But the thing is, we just have to look onto the whole problem rather than just seeing it as like we are giving 2 hours and the child is not eating. Then what is going wrong over here? The thing is, which we have already discussed over here, Piyush, that the full meal is served. And now you want to complete the full meal at that time. Better you take 5 to 10 minutes, which will save your time also. Okay. And then let the child eat however or how much the child wants. Take a break of an hour where you can finish off some of your work and then again come with the food, changing the colors, changing the brightness, not the same food item which was served earlier or not the same taste which was given earlier, and then again try to feed your child, which will start from the morning breakfast, because the breakfast is the most important meal of the day in this growing age where the child is. So start from there, divide the meal in whole day also for 5 to 6 times. And when you're feeding also, that time also the meal should be divided into 5 to 6 portions.
Okay.
So over here, I think so this would be helpful for those parents, as you are telling about, who are facing this problem. I believe that it would be definitely helpful for them.
Definitely. Dr. Monica, would you like to add something?
It's about gradual sensitization or gradual exposure to healthy food and gradual desensitization from the screen. Both the things have to be done gradually in a graded fashion.
Okay. And probably we'll discuss more similar solutions in a structured manner in just another 5 minutes. After we have discussed the next question, which is, how does picky eating affect a child's health? Now we have established that picky eaters do not get all the nutrients that are required. So how does it affect the child's health?
See, picky eating, if it lasts for more than 6 months, it is known to cause growth impairment in children. Now, such children, they fall behind their peers in their weight scale, first of all. And then gradually, if the picky eating continues for a year or so, they also fall behind their height with their peers.
Okay.
Also, the poor eating habits leads to a nutritional imbalance, I'd say, which decreases the appetite.
Okay.
And it also results in micronutrient deficiency like zinc and vitamin B1. So if there is a deficiency of zinc and vitamin B1, because you're not giving it in the food anyway, it will further lead to anorexia. That is, the child will, it will force the child not to eat, because whenever the child will see the food, he'll want to vomit.
Okay.
It will also decrease the level of vitamin C, thiamine, riboflavin, niacin, all the micronutrients.
Okay.
Which in result will decrease the immunity of the child and will also result in cognitive impairment. Right. That is to say, it will slow down the mental function of the child over a period of time. I'm not saying a 2-month period will cause this, but at least one year to 2 year, period might cause this. Picky eaters are also known to have constipation because the diet the diet that they consume, it is very low in fiber. And if the picky eater eats more sugar, more sugary content, the child might also develop dental caries going forward.
Yes. Because we have seen a number of cases where children are suffering from similar dental issues under the age of 5. Dr. Garima, would you like to add some points? How does it affect a child's health?
See, health we have basically discussed with Dr. Monica. I just want to throw some light on the mental process also. When you say that what is the effect on the health, it comprises of both the physical part also and the mental part also. And before the mental part, I just want to know how this cycle becomes. It is like when a child is not taking all that important nutrients and micronutrients, the immunity system will slowly become weak.
Yes.
The immunity system, when it will become weak, the child will be more prone to infection.
Yes.
Again and again, some or the other infection would be there. Infections more, that means the child will start falling sick. And when the child regularly after a specific interval falls sick, we all know how it troubles the parent. And over here, when the parents are in this much of stress, that comes on each and every family member.
Yes.
So over here, the weak immunity and the concerns go to the parents also, where they are disturbed because of the child's weak immunity, but they are not able to find out the correct solution, where to go, what is this happening, because in the diagnosis also sometimes so easily it will not come that vitamin D is not there or B12 is not there. You have to go for higher further investigations for that.
Yes.
And you'll also see the decrease in the intellectual activities also, the thinking process, what do you want to remember, what do you want to express, how it's going on, all these things also will slowly decrease in the child.
Okay. So what I've understood is that 50% of children are suffering from picky eating. It means that the overall situation looks simple, but it is not. It means that children are not getting proper nutrients at home. And second, you have said that if this trend continues, then it will lead to a lot of further diseases, as Dr. Monica said, anorexia and dental caring, and the growth parameters, weight and height, not getting proper attention and not getting developed on time. Then Dr. Garima, you said that it will affect the immune system, followed which the child will be prone to getting more infections compared to other healthy children, right?
Yes.
So basically the problem is not just physical, it's not just nutrition on restricted on a nutritional level, but it's all holistic. If not taken care of, as Dr. Monica said, that if it continues beyond 6 months, it will lead to the holistic deterioration of the child, be it the psychological issues or other developmental issues, right?
Also, I missed on iron deficiency. It's very common to see picky eaters having iron deficiency. It's very common.
Okay. And what do you say, Dr. Monica, especially from you, and what are the tests that the parents should take care of just to see or just to get the numbers? Because once the parents have the numbers, probably then they can go to the doctor and, take care of the things. What are the basic tests that parents should take care of?
See, CBC, LFT and liver function tests and kidney function tests once a year would do. Vitamin D and all we do not recommend because it's a very expensive test.
Okay. So once,
and then on, it also depends on your family history, and it also depends on the current clinical condition of the child.
Okay. So basically,
yeah.
So sorry, you were saying something. Please come.
Yeah, these are the tests that need to be done routinely, like once a year, twice a year.
So broadly, you want to say that if the child comes to you after judging the child holistically, probably you will write down the tests that are required. Some will be basic and some will depend upon the personal condition, current condition.
Right.
Great. So now we have talked about the causes and the problems that picky eating results in. Now, Dr. Garima, can you talk about the structured solution or structured strategies to deal with picky eating? How can a parent how can a parent strategize or structure picky eating?
Definitely. I would just like to tell that. But before that, I just want to make one thing clear, that if you are seeing all these behavior change in your child, please don't judge it by anybody else telling you that the child is having any of the mental disorders or he is suffering from any of those problems. It's just not like that. It's just the anxiety, you can say, or the social behavior change. That's all. It's not a mental disorder at all. So don't be worried so much. But yes, as you are telling Piyush, that you have to plan it. Please strategize it and then work on it.
Yes, yes.
So the strategies which you want to say, that's the first of all, respect your child's appetite. What he want, how he want, please solve that. And when you see the changes, try to accept those changes and then try to change them in a healthier way.
Okay.
Plan the things. When you are planning the things, you will introduce a new food, definitely. And if the child is not accepting that food, please wait for 3 to 5 days. Don't be in a hush bush. Have patience that yes, you are trying slowly, the child will accept it. After that, what you have to do, don't be so much short order cooked, as we have earlier discussed it. I don't want this, please change it. No. Rather than that, make it fun, how the child can accept it.
Okay.
And then help your child. Don't bribe your child, like after completing a meal, you will get a dessert. You will get dessert is a part of food. It's not an award, or it's not something when you will complete a meal, then you will have it. Fix some interval of days, Friday, Saturday, Sunday, whatever. Okay, that day you will get it because it's a part of meal. It's not that when you will complete a meal, you will get a dessert. So please don't do that, and see to it, might be possible you are comfortable on that structure, the tables, the chairs, or wherever you are having your food, but child is having some problem, is not able to balance, and now it is like he is not expressing also. How he will tell that it's so high, you know, that 2-year kid, or it's so low, I am not able to eat properly. So see all those environmental issues also.
Okay. So you're saying that the first and the foremost part is respect the appetite. That is, don't force your kid.
Correct.
Accept it.
Yes.
Don't push it. So once that first step is done, then probably parents have to introduce different kind of food materials, and that
Yes.
also without a push, right?
Yes, that also without a push.
Introduce different kind of food materials so that parents will get an idea of what sticks with the child and what doesn't stick with the child. And once they understand, probably in the process of 1 or 2 months, what sticks with the child, they can come up with a routine and fix that routine, is what you're saying. Then they can look into the environmental changes, whether the seat on the dining table is high or low, or the food is served, farther from where the child is seated, where the TV is on or not, right?
Yes.
But the first step is to stop pushing the child.
Yes. You have to tell the importance rather than just telling you have to eat it. He also wants to know why I have to eat it. What is the importance?
Yes.
Exampleize the things, set a good example in front of them. Like, see, can you see your mother is having so shiny skin, or your father is so strong? How you will be like that? Have this, with this, your bones will be strong. See, this hard part is bone, your bones will be strong. So like this, set a good example in front of them rather than just forcing them. And I believe slowly, they'll definitely understand when a routine and an environment is created. You have to be with your child.
Okay.
Yeah.
Dr. Monica, can you from your side, can you tell how can a parent structure the weaning process? Because I think that leads to picky eating. How can they structure the this weaning process?
Also, adding to what Dr. Garima.
Yes, Dr. Monica. Dr. Monica. So we have seen that, I think, Dr. Monica, there is some network issue. Probably she'll join in another half a minute. So parents, you must have understood that bribing a child is not good. Pushing a child is not good. You have to be a friend of your child. And one thing that Dr. Garima said that I would like to mention is that don't short order cooking. Don't do short order cooking. What is it? This happens when the child is completely rejecting every food and pushing you to make different kind of food, wherein the child says that he or she wants spaghetti or pasta, and what you do is you just go to the kitchen or ask your house help to make it. You don't have to comply to each and every thing that your child asks. Now Dr. Monica is here. Dr. Monica, how can we structure the weaning process as parents?
See, first we have to decide when we want to wean the child. Do we want early weaning, or do we want weaning that has been practiced since long? Because the child starts teething at 4 months. So when the child starts teething, the child needs something to chew, because he has itching in his tooth, so he needs something to chew on, so that he can, he does not grab unhealthy stuff. Also, complementary food has to be started in a graded fashion. You start with mono cereals first, then go on to multi cereals, and then cereal pulse combination. By mono cereals, I mean start with rice or probably wheat. It's better to start with rice because it's gluten-free and easily digestible. After that, combine rice and wheat. Then you can add on pulses to it.
Okay.
Also, try to make the food that you're giving the child nutrient-rich. You can add jaggery for calories and minerals. You can add milk for protein and carbs. You can also add oil for extra calories.
Okay.
So at 6 months around, you should start with a cereal-based porridge.
Okay.
Rice kheer or suji kheer, and you can add jaggery or ghee to it. Start with 1 to 2 teaspoons and then gradually build on it. And at 6 to 9 months, you should start with mashed items. Okay. And that is the time to start egg for the child also. Start with egg yolk first and then shift on to the egg white.
Okay.
At 9 to 12 months, the child can easily chew everything that that's made in the house.
Okay.
So whatever the home cooked meal is, you can serve the child that. And by 3 years of age, the child will start eating half of what his or her mother eats.
Okay. So probably the next question was also in the similar direction. How to introduce new food in the child's diet? Dr. Garima.
Yeah, so first of all, when you are introducing a new food in your child's diet, first see some physical developments. That means the child can sit without support. He can or she can balance their head or not. When the child start grabbing the things, holding is the hold proper and tight. Okay. And you will also see your child is with you, you are eating, the child leans towards the food. That means now he is just noticing all those smells.
Yes.
Okay, and he is getting attracted towards it. He'll start leaning towards the food.
Yes.
And small items, whatever is there in his or her reach, they'll pick it and they'll pop it in their mouth.
Yes.
So when all these developmental process you are seeing physically, that might be the correct time when you have to start feeding your child.
Okay.
And after this, then try introducing the new food item, and that to give a break, as we have discussed, of 3 to 5 days. Because what happens in between might be possible, you see that your child is having allergy with some of the food items. That's also possible. It's not like that whatever we are introducing, that the child will accept it or the body will accept it. Might be possible the child is having allergy towards any of the food group like protein, dairy, or something else. So in this 5 days or 7 days, you'll also come to know that.
Okay.
So this would be the proper process when you are introducing the semi-solids or the lumpy mashed food or the normal food items in your child's diet.
Okay. Dr. Monica, any last thoughts on the same?
Also, I'd suggest parents to continue breastfeeding till 2 years.
Okay.
Because it has been shown that children who are breastfed, they accept new food easily.
Okay. So you're saying that the weaning process should start at 6 months, but along with that,
continued breastfeeding till 2 years of age. Yeah.
So by the end of 2 years, the child will be breastfeeding as well as eating the solids, right? And that is a full disconnect. Probably 90% solids and 10% dependence on breastfeeding.
Yeah.
Is what you said. Okay. I think so. Till now we have discussed the problems and the solutions, and I can see that there are some questions. So I would urge Mr. Himanshu to please ask his question.
Hey, hi guys. So I have a couple of questions. Should I just go through one by one?
Yes. I can see that you have 5 questions. You can start.
Yeah. So please stop me whenever you think it's getting and you want to bring someone else. So the first question is, it is coming from an observation that is it true that picky eating is generally found in, in households where there are too many options? For example, a typical, comparison that I do, in my maternal or paternal home in villages, kids eat everything, no problem, no picky eating. They eat dal, roti, chawal, right? But the moment you come to cities, where you have a lot of options in the household, suddenly, the drama increases. So that
Yes.
was my first question, which actually leads to my second, that meaning that are we trying actually too much? Meaning just usko bhuka chhod do, when he wants to eat, he will show something. And then when he's really hungry, then he'll eat anything. So my first and second question is my own theory, but I don't know if it is right. So that's my question.
Okay. So I think the question is very clear. People in villages or children in villages, they tend to not create the drama at home and tend to, we observe that they eat everything, whatever is served. And in cities where there are too many options and probably parents are also, asking a lot to their children and they tend to create some drama. Who would like to take? I think Dr. Garima would be best to answer this question. Dr. Garima.
Yeah. So over here, it's like we don't have to go so much far away. Just now, abhi humne discuss kiya media. First thing, which is not there in the village houses, they have open field. They go, they play. When physical process, matlab jab mechanism already ho raha hai, they are physically working so much. Definitely, they'll feel hungry. And what is there in the kitchen? No pastries, no pizzas, no burgers,
exactly.
no outlets. कुछ देखा ही नहीं है हमने किचन में. सिंपली दाल, राइस एंड चपाती, वो जो मम्मा ने बना के रखा है. I have played so much, I am hungry. Definitely whatever she'll serve, I'll have it. First thing, we can easily correlate with it what is happening over here. Over here, what happens, the child is not getting that kind of environment. He or she, they are not going out also in a lawn 2 rounds and coming back. We are little protective. If we just exclude this group of COVID, before that also we were little protective, that we want, okay, this much is enough, you come back. Okay, and over there we ourselves serve 5 things on the table. Yes, you are here, so now you have to eat it. This is good in protein, this is good in vitamins, and this is because we have too much of knowledge, and we just want to put that knowledge on a child rather than just experiencing that apple is enough for that child on that time. That's enough. But we will have so many options, and we ourselves are introducing the option. So this, when we ourselves introduce the option, both the things correlate, and as a result, the child now knows what to pick and eat, where it results in picky eating. That's so simple. I think so. Dr. Monica also will agree
I totally agree
with me in this background.
Totally. जितना ज्यादा ऑप्शन होगा बच्चा उतना ज्यादा कुछ और मांगेगा. उसे लगेगा पापा मिला सकते हैं, तो he'll try and coax them to get something good for him.
Yeah, we have already told na, media or like short cooked, order diya, abhi it's cooked and it's here. House helps are there. Over there the mother is only there.
Parents are guilty ना, उन्हें लगता है वो time spend नहीं कर पा रहे बच्चे के साथ, तो they try and compensate कि we'll give the child whatever the child asks for.
So I am not a doctor, but I would like to add 1 or 2 things. So when he was asking this question, I could go back to the discussion that we have had, and I could choose 2 things. One was parents being protective, that the environmental factor we had mentioned. Worried parents or protective parents, that's one kind of behavior that the environment that parents create. The second is that either leads to pushing the child to finish the meal then and there itself, or the second thing is short cooking, wherein the parents, they do not have time. They are tired of pushing the child. Now they go to the kitchen and make whatever the child is asking. So now these are the 2 things. So basically the problem is coming from the parent side, because either they are pushing, they are becoming protective, or they are giving the child whatever the child is asking. And the child has more options, not just from the parents who have kept 5 or 6 things in front of the child, plus the child is exposed to the media, wherein they can see the chips ad or burger ad or things like that. So probably, so what is your third question? Hopefully we have answered the first two.
Yeah, yes, thanks a lot. So my third question was about deficiencies. So in the middle of the discussion, we started talking about a lot of deficiencies.
Yes, yes.
So my question was like how to find that out, because it is generally a blood test, right? Or we have to look for some symptom and some things, and then how often to test and find out? Because
We
many
do not-
people talk about iron, that iron is super important, but then how do we know that is it okay or not?
See, CBC needs to be done once a year, Himanshu. In CBC, if you look at the HB of the child, hemoglobin of the child will be low. And that is when we call the child to have anemia.
Okay. Okay.
So meaning every year.
So, मोटा-मोटी less than 10 HB अगर बच्चे का होता है, तो we have to start iron supplementation.
Okay, which means that each year every kid should actually have a blood test.
Baseline test every year, yeah.
Okay.
The CBC, LFT, KFT, 3 routine tests. Yeah.
And this should be like even for like less than 2 years also?
Yeah. If they are bottle fed, especially if they're breastfed, then there's no need. But if they're bottle fed, you know, you've started formula feeding early on, then they do need those tests.
Okay.
Okay.
Cool, got it. Then fourth question was that there are many kids food options in the market, like fortified puffs, which are like cereal snacks. So are these okay, or these are like something to be avoided? Because what we are seeing is that he's actually, my kid is 14 months old, but he has actually started saying that he needs that puff.
Okay.
This one.
Dr. Garima,
I
you have a strong opinion on such food, yeah.
Yeah, I will strongly not recommend it. मैं ये बिल्कुल भी नहीं पसंद करूंगी. Whatever kid I see that the kid is formula fed ever. So you can just ask your mother, your grandmother, where these formula were in our time or before our time, but definitely all of us are healthy and we will be healthy. So I don't want this formula food to be introduced. Why? Because it's very much processed. What you say, processed, above them, ultra processed. And that food is not properly digested by a kid. उसका जो डाइजेस्टिव सिस्टम है, उसका जो स्टमक है, लीवर है, अभी इतना स्ट्रांग हुआ ही नहीं है कि वो उन सब चीजों को डाइजेस्ट कर पाए, और वो rather than being good, it can be bad. It can hamper the digestive system. The small food items, small food means the simple food items, which would be, you can say dal or rice, where also you'll take out the watery part more, not the concentrated part. These are the small things which will go and slowly they will break down and then convert it into energy. जब वो body में जाएगा, it will break and convert into energy. But these formula foods, they go, body उसे लेते ही नहीं है. Why? Because the body is not at all prepared for that, and they come out like that only. And from here, flatulence, gaseous trouble, improper digestion, all these problems also you will see. As Dr. Monica have already told, no fiber in all these things. Constipation will start, stomach ache would be there. Kid is continuously crying, all the tantrums. So all the bad things I can see. From my side, it's like, I will not say that I'm not in the support or I'm against, but for me, if you'll ask, I will never ever suggest anybody to start a kid with a formula feeding. Okay, rarely if it's something is there, you are somewhere out and you want it once in 2 months or 3 months, okay. But daily, if you see that the meal is based upon the formula food, no, not suggested.
How should they manage the child then? If the child is asking and crying, what should he do?
No, who introduced it to the child?
Yeah, correct. That's what.
Cool.
We only introduce it. No.
Himanshu, where did the child see it first?
Actually, it started, in this case, it started when we were eating the normal biscuit, and he started wanting the normal biscuit. So we said that why give normal biscuit if there is kids biscuit available?
Okay.
So we thought that normal Good Day is bad, but this is better because this is at least kids food. That's what.
Both are equally bad. You should ideally not give anything processed to child before the age of 3 years. The first processed food that the child should have should be after 3 years of age. Never before 3 years of age.
So
घर का खाना नहीं तो घर पे cookies बनाना.
Right.
Again, okay. So what is your next question?
My next question is actually self-answered already. because it was on very similar lines. But that's a very specific problem in our household, is that the protein consumption in the household is very high, meaning that to be able to live our lifestyle, we need whey protein and everything. The child really sees it. It is super visible to him. So he really wants, for example, whenever I am having my whey protein shake, he's super excited. He wants to have 1 or 2 sips. So is that bad, or is it okay if he has a little bit of it?
One or two sips here and there is okay, but on a daily basis is not, because again, whey is also processed.
Right.
How do you define, Dr. Monica, how do you define here and there?
Here and there, once in a fortnight.
Okay, in every 15 days, you can just give a sip.
Yeah.
So it seems that directly or indirectly, the child is getting the exposure from the parents. It's difficult. Yeah, it's difficult to differentiate.
Parents can't stop living their lives just because they have a kid. That's not possible. But, gradually, they can start introducing or, try and explain things to the child.
Okay.
So basically, till the child is not able to understand, just hide from him and eat, basically.
Give him a water in a sipper. Give him some water in a sipper. And tell him it's the same thing. And get one of those steel wala shaker. He won't know what you're drinking then. You say it's water.
Basically, you're not bribing and you're not being protective. So you're just hiding, and the child, that's what is happening, right?
You will obviously tell the child about it once he's, able to understand it. But before that, you'll have to do something, about it. The child will start crying.
And just one question came to my mind, like the child needs 1,000 to 1,300 calories. How should they divide the calories? And if the child is a picky eater and rejecting the familiar food and not getting introduced to the newer food, how can you provide the nutrients 1,000 to 1,300 calories? And what is more important to the child? Dr. Garima.
See, if you want to distribute the calories over here, it's not important that you distribute it on per day basis.
Right.
In these small kids, it's not important that in one day the child should have 13 to 1,500 calories. So you say to it that only in a day. It can be distributed in 5 days or a week. Okay. And the small portion which are served should be rich and high in calories. As an example, curd, banana, rice, lumpy rice kind of a thing when you cook. So these all things are here, which can be just easily fed, soft, chewable nicely, and they are also rich in nutrients, but equally amount high in protein. And yes, not if somebody like they can give vegetarian, so egg also. So what happens is, when we count the calories for these kids, sometimes it happens that they just are not able to take it in a day. So see to it that whatever you want to give, let us take an example. Humne itna sara example here, we were saying iron, we were saying calcium. Now how? Calcium means all the milk, dairy products. Iron means your green leafy vegetables. So it's not possible that in a day that small child will take everything. So you just see to it that one day if you have given an amount of iron which should be there in child's diet, then other day, alternate day, calcium should also be there, or alternate day, some dal should also be there, so that everything is equally divided into a week rather than in a day. And that will be more helpful.
Dr. Monica, I think, would you like to add something?
In a clinical experience, we ask parents to make nibble trays. We ask them to take an ice tray and put the ice tray and put colored food items, different colors for the child, and keep it within the child's reach. So whenever the child is hungry, the child will grab a pea-sized amount and eat it. Okay. Also, you can, ask the child to dip his favorite, whatever he likes, into, some cheese or some yogurt. And that way he'll also like to, he'll like it because he's creating a mess which children like. And also he'll love the taste also. And probably then it'll get him to eat more. Also, if the child is not eating, you can put something that is readily accessible to the child in the refrigerator on the lower shelf, so that whenever the child is hungry, the child can go and grab it.
Okay. hopefully we have answered your questions, Mr. Himanshu.
I got confused in that calorie numbers. So
Sorry?
what was that? 1,000 to 1,300?
Yeah. In a day, a kid of 3 years should have 1,300 to 1,500 calories.
A child
When
of
you-
2 years of age, 2 to 4 years of age.
Yeah, 2 to 4 years of age. In
Depends
between
on the
this.
weight of the child.
Yes, just
Right.
I'm talking about a normal BMI. When
Yeah.
a child is in normal body weight, it is okay. But now if you have some investigation, child is having some problems, then you can just see to it how it varies. But this is the basic count which a child should have.
Got it. And on the processed food, we talked a lot about processed food, but these things like Cerelac and oats,
Cerelac is processed.
so
Oats
that
are
is also
processed.
should be avoided, right?
Yes. Cerelac is processed. Oats, the Quaker oats that we have, it is processed.
Okay.
ever. Steel
So
cut
iron
oats
ke
are
liye
not
then-
processed. Iron ke liye you can give green leafy vegetables. You can use jaggery powder for the child. You can also use apples, bananas, and something else. Dr. Garima, do you have to say something?
Yeah. You can also use mashed peanuts. Grind the groundnuts, make powder out of it, and just half a spoon of powder, anything. Peanuts are the richest source, like which is easily available. Peanuts are the groundnuts, they are the richest source of iron. After that, you can also go with the, you can say pulses, but pulses, please see to it that the concentration, jaise hum banate hain, rajma can be there, or you can say lobia can be there, that much a child should not have. Pulses in the sense where 8 and 10 in a very small bowl, you can say the small bowl of ours, half to it, 1 spoon of ours, that much intake of a rajma or a cowpea, lobia, what you say, all these pulses is more than enough for a child.
10 gram per day hota hai, mere khayal se.
Yes, 10 gram per day. It's very nice. You can just simply boil it. And the local thing which is available is your kabli chana, very much rich in iron. Just boil it, take 8 to 10 pieces, mash it nicely. You can also add a piece of boiled potato and it's a rich meal. No problem in that. That's also rich in iron. We don't have to go somewhere out. These are the richest source of iron.
You're also talking about some powder, ye chana and jaggery.
Yes.
Some
Yes,
powder.
the nuts powder is there. No, we take 2-3 nuts and powder it with the raisin. You just cut raisins and involve, and you can keep it in a box. Child will have that habit on the table. No, small box, he'll come and he'll just open and eat it. He'll be more happy in that. No problem in that.
Got it. It's clear.
Okay. Does anyone else have any questions?
Sorry, I had one more question. So the child was mostly formula fed in our case. So I mean, shifting from formula to cow milk is like it should be like done, because we see a preference for formula in his case.
Cow milk at 14 months, I'd say no, Himanshu, you can start cow milk after the age of 2 years.
Okay.
Because such children develop cow milk protein allergy very commonly if it is introduced before the age of 2 years.
Okay.
So
till 2 years, formula should be like fine.
Formula or buffalo milk, normal milk.
So okay. So normal milk is generally buffalo milk.
Yeah.
Oh, okay. So buffalo milk is fine.
Yeah, it is fine. It's very high in calories, also high in fats. So it is good for child.
Okay.
Without bottle.
Without bottle?
And with katori, chammach or a glass. Now he's 14 months, so you can obviously assist glass.
Okay.
Without bottle, yes.
Okay. I would just like to say that we are a pediatric care company and we provide holistic child health subscription, I would say. And we have started a free trial of our subscription. And I would love if you guys would want to register for the same. I've shared the link in the chat box. I think you can open it up and fill your registration form. The first month is going to be free. And this free trial includes both the things. Generally, what happens is the questions that Mr. Himanshu has asked, it seems that parents do not get to know when the problem is happening. After the problem happens, then only they go to the doctor for consultation. And in our subscription, we have included both the things. First is you will have your 15 to 20 minutes consultation per month with the pediatrician, so that so you can ask your question from the pediatrician, and all the data will be shared and all the knowledge will be shared in that particular consultation. Other than that, there is an urgent care facility wherein we provide 24/7 urgent care on chat or WhatsApp. And second, we provide 2 urgent care calls on a monthly basis. So this first month will be free in our free trial. So I would like you guys to register on the link that I've just shared. Mr. Nilesh, Ms. Seema, I would urge you guys to ask your question. Yes, I think everyone. Everyone is clear on all the things we have discussed. So yeah, we would like to thank everyone who has joined on this Sunday evening. And second, we would like to thank Dr. Garima, Dr. Monica. Would you like to say any last words before we finish the meeting?
Dr. Garima, you go first.
Okay. So I just want to wind up with one line tag. When you are talking about a child, don't be so much stressed that now, as Dr. Monica have already said, you also want to live your life. We all know it very well, but just pick up small things and take care of them, because the child is your part and he is your heart. We all know it very well. So I just want to comprise it with that definitely you live your life also, but just focus on small things, and by the time, not suddenly, but definitely gradually, the things will improve. Thank you so much. Thank you, Piyush.
Thank you, Dr. Garima. So thank you everyone. Thank you very much for joining. Bye-bye.
Thanks a lot, guys.
Bye.
Super useful.
Bye. Thank you.